Dr. Matty Moore, for being on the podcast again.
No worries. It's great to be with you, as always, Alex.
So our first chat, which was episode 3, which would have been a couple of months ago now, we did a general overview on how medicinal cannabis might be used in pediatrics. And today we're going to go a little bit more specific into autism. We're going to chat a bit about the condition itself, the difficulties around it, and then also how medicinal cannabis may be used in some circumstances. I think probably let's start off just talking about it generally. What is autism and what are the different types?
Yeah, sure. It's a neurodevelopmental condition where, children up to, age, basically, they're diagnosed from anywhere from 2 to age 7 typically. And then, some definitely don't get caught up until later on and even in adulthood. But, these patients have difficulties with communicating and actually interpreting the environment. And so that is it's called a spectrum because there's so many different varying abilities and differences there. So no one person is alike. And honestly, buddy, like, what is normal these days? We're learning so much about the neurodivergent brain, and it's funny how many times I see folks and I'm like, dude, maybe I have a little bit of that. I've got a little bit of that. It's like, oh man, so we're all on the spectrum at some point. So those folks have real difficulties in social situations, and really what we treat as GPs is those behaviors that could be better, and that tend to be difficult, and also get in the way of those patients' daily living activities. There's so many comorbidities along with that neurodivergent brain. So it's there's not really any known causes other than some genetic disorders that it's associated with, like Fragile X and tuberous sclerosis, and anywhere from like 10 to 40% is genetic, and look, the rest is a little up in the air. We're not exactly sure. We know that it's not due to immunizations. I mean, that's been poo-pooed on, and like, it's been proven over and over again with these huge sample size studies, which show that no relation, no causal effect of these immunizations. So then what we're left with is there an environmental piece to this? There's not a whole lot of data for that yet, but mostly genetic. So it's in about a 1% of our worldly population, and that's millions and millions of people. And I think there's probably more than we know of. I mean, it's a 3-to-1 ratio of male to female, which is, that's thought to be probably more leaning towards increasing to a 1-to-1 because of so many late diagnoses in females, because they present differently and they mask better. So those are often lost as far as diagnosing until later. So that's about 1 in 70 to 1 in 150. There's no real, there's no cure, of course. It's always, something a condition that patients will have to live with and get better at some of those difficulties that they have and really learn those things differently than you and I would.
So there's a big spectrum. So there can be the one, there might be more social skills, and maybe they're not getting eye contact or that sort of more subtle types of signs, which is probably where, like you said, a lot of people probably can identify with and go, well, I probably am on that part of the spectrum. But then there's the other end of the spectrum as well, where there's nonverbal, right?
Yeah, and intellectual impairment. I mean, that's a lot of 40% of the diagnosis has intellectual impairment. So I hate the term autistic or the disorder. That just is a negative connotation, and certainly my patients who have ASD are like, hey, watch it. I'm like, wait, what did I say? Did I say something wrong? They're like, disorder. I'm like, well, shoot, that's what it's called in the DSM, our diagnostic manual. So it's not something that comes, that I'm thinking is a negative diagnosis, but sometimes that disorder has a negative connotation.
And you also said that it's usually diagnosed around from 2 years old to 7 years old. So from what I've read, babies and things can develop normally, meeting all their milestones to about 18 months, 2 years old, sounds like maybe even older. And then all of a sudden it stops, or even they maybe lose some of those skills. What is the theories behind this? Because like you said, there's lots of causes that we're not really sure about, but what's the theories around why they can develop normally, meeting milestones up until a certain age and then it just stops?
Well, I think it's just the brain develops to a certain stage where it can't develop that way and that quickly. And so that it uses its growth factors, the brain and its development for, those really major things. And this is just a theory. No one really knows for sure, to be honest, but at some point, development gets worse, and therefore you kind of have to really delve into, all right, what are the deficiencies? Is this a metabolic issue? Because you've got to rule out things first, right? Before you say, oh, that child has ASD.
And when you say metabolic issues, are you talking like a diabetes type of thing?
Yeah, totally. Like some deficiency in metabolism, or, cellular metabolism, or something that's genetic, and the trickle down of that is there's a deficiency there. Yeah. Like it's hard to really to know for sure. I mean, we're doing so much research on it.
And I know there's a bit of talk around the gut microbiome and autism. Is there much evidence around that? Or is that, obviously the gut is such a big area that we still got to learn a lot about as well. Do we know if there is much of a link there?
No, there's not any definite causal link there yet. There's lots of supposition and therefore studies going on about it, but not really any direct link.
You don't hear often, I haven't heard often of adults with autism, but there must be adults with autism.
Of course there are.
Are we just focusing more on children because that's when we're looking more at milestones?
Yeah, definitely. And I think that's when it's most obvious, when we're developing, and there's a norm where we see development going. And then when there's something that's abnormal, it's like, and we're so focused now on diagnosis, like where we weren't, it was so underrepresented and underdiagnosed for so many years. And now we're kind of catching up on our awareness. And I think that's why you're seeing an increase rather than seeing autism increasing because of some factor. I think we're just more aware and being able to diagnose it and understanding it and learning about it and learning about the neurodivergent brain.
Before, you mentioned as well about certain behaviors. So when it comes to treatment options for autism, it's looking more at treating certain aspects of autism, right? So what sort of behaviors are you referring to?
Yeah, autism spectrum disorder isn't something that you can give a medication for and it reverses it, like, or limits it or turns it back to normal pathology or anatomy or physiology. So there's no treatments for the actual disorder, but we treat the result of that in emotional and behavioral therapies, really. And that's basically what we do is we get social work involved for the families. We get occupational therapy, psychologists, speech pathologists. You've got your psychiatrists who are on board because of the many kind of mental health associated comorbidities with ASD. Pediatricians, as in Australia, we have a multidisciplinary team that gets together and diagnoses this, and that's not a fast process. It's very long, and it takes all of those brains and assessments together to give that diagnosis. And then, after that, it's really getting the support together And if you're diagnosed, before age 7, then you have access to the NDIS and all of that funding, really that's required, because you can imagine all that extra support is not free. And so, previous to the NDIS and government support for this, gosh, how are we getting it done? How could you possibly see the speechy, the occupational therapist, and the pediatricians as often as it needs to be, initially at least? Gosh, that's a lot of dough.
I mean, that's obviously one of the biggest challenges when parents are being faced with or discussing that their child is maybe autistic. Having to go to all of these different therapies as well must be very time consuming.
Overwhelming. My gosh. I mean, having that diagnosis when you're really unaware, I'm sure parents and families have a potentially, can see, okay, maybe this is going in that direction, but that's a big step. That's a big transition. And educating yourselves and understanding how you can help your child and understand their brain so that they reach their potential. Gosh, that can be overwhelming. And the time that it takes and organizing all of that support. Man, I see it a lot, and families are tired. They're overwhelmed. They're reaching out. They need support. And, if they don't get it, it's really difficult. It's really difficult, a difficult diagnosis for a family.
And so the area that you specialize in is medicinal cannabis. And this is one potential treatment option that people are using for autism. Can you explain a bit about how does it work and what sort of behavioral aspects is it treating?
Well, yeah, I mean, it's no silver bullet. It's not snake oil. It's not for everybody. We have to have a diagnosis of ASD, and patients have had to have tried first-line therapies for those issues that we're treating. And, that's typically, behavioral disruptions, sleep disturbance, anxiety, mood disorders that are associated with it, and the neurodivergent brain with ADD, ADHD, that comorbidity. So those are managed differently, and you got to be aware and think about that.
You had also said before that autism's linked with other sort of learning difficulties. So like ADHD, is that sort of, and maybe depression or anxieties or?
Yeah. The dyslexia, some, sensitivities with, auditory and visual processing issues. So yeah, there's lots of complications that come with ASD and potentials to help and treat symptoms there. So a lot of these families are in distress because they've tried all this stuff and they see how their son or daughter is flailing and floundering, really, and behaviors are getting worse, and grades are suffering, and social relationships at school, and it's just so isolating, this diagnosis for families and patients with it. It can be really, really frustrating for them, and that's really where it results in behaviors that aren't nice to be around.
With any medication, obviously before starting treatments, you're looking at interactions, and each person's going to be different with what other kind of diagnoses they might have, or learning difficulties, mental health problems. Can medicinal cannabis impact a child's learning in any negative way, or does it generally work more to improve their learning abilities?
Well, by and large, it improves it because you're treating those comorbidities, those symptoms, which kind of slows things down. Allows, let's say, for example, a child with anxiety also, which a lot have. I mean, I haven't seen a whole lot of children in my office without anxiety, to be honest. And treating that improves patients' ability to sit there and think and finish their work and have those social interactions without worrying about the what ifs, because that's what anxiety is. So that allows them to finish their testing and finish their tasks at home, and, stop the brain at the end of the day from ruminating and having, panic type symptoms, which is what that hypervigilant brain can do at the end of the day. It just keeps going. It's zooming, about, oh gosh, what about this interaction? What did she say? What about tomorrow? What if I don't do well, or what if I don't wake up, or, if you treat the anxiety, the child's brain development, typically is a lot better, and behaviors improve and grades improve.
And are we looking at a THC CBD combination for during the day for anxiety?
Yeah, sorry, I didn't address that, but yeah, when the thing that we have to be wary of in treatment with cannabis is THC is really the part of the cannabis plant that comes with side effects. CBD is generally very well tolerated. You can use, a lot higher doses without much, negative results. But your side effects typically for children would be, like you said, fatigue or sleepiness with THC, and we don't want that. So I really have read a lot of the data and the papers, certainly in this space, and tend to treat kids with CBD majority with very little THC, because I just don't want to. We're very careful with that developing brain. We don't want it to alter it in a way that they can't reach their potential. So, and quite honestly, CBD majority oils with very little THC have great results without, the negative side effects. CBD can help anxiety as well, without using THC. It can be very calming without that psychoactive, negative properties of THC.
Is the treatment, like medicinal cannabis, the way that it's working for something like anxiety, is it just helping with calming them while they're taking that medication during that time? Or is there any evidence of it showing it helping with like rewiring anything or any changes?
There's not a whole lot of evidence on rewiring yet. We're certainly doing a lot in that space, but really we're treating symptoms and calming and, allowing them to slow things down a bit without, the ramp up of the what ifs. And
like you said, you can use it to help improve sleep. And I suppose if, kids or all of us, we need really good quality sleep so we can function best during the day. So I suppose just even by improving a child's quality of sleep at nighttime, that should improve their learning and their focus during the day.
Hugely dynamic. Yeah, you said it. I mean, a good night's sleep improves everything. And, you've had a poor night's sleep or a night shift. The next day, I'm super emotional, like crazy emotional and more anxious. So yeah, I've lived that one myself. And with a good night's sleep, the result of that is across all body systems, to be honest.
When you're lacking in sleep, when you're faced with a problem, it's an emotional based problem solving as opposed to a mental capacity of problem solving.
There you have it. Absolutely.
Do you have any good case studies that you can talk us through where you've used medicinal cannabis for autism?
Yes, several, to be honest, and probably more than you'd want me to talk about. But yeah, seriously, like one would be, I think he was 5 or 6. Not verbal, communicated with chirps and noises, but and with gestures with his hands, super bright, and like I could tell the first time I met him that he was so frustrated about his inability to communicate with me, and so we started him on, CBD majority oil. And like literally within the first week, he started putting words together for his family. And his family was just like, you won't believe it. He started talking so that's one really eye-opening case, for me. It was just like, wow.
How old was this child?
6, 7, maybe.
And he had never spoken?
No.
Wow. And so you could tell he had all of it up in his head.
Absolutely. It just, he couldn't get it out.
Imagine the frustration.
Totally. Like I could tell, I could totally see it. You know, you can imagine being able to do that for the first time. Like, holy cow. And he's so proud of himself. Like he's just, you know, popping around, confident, you know, not as frustrated anymore. And, you know, he's such a lovely little guy. He's so sweet and smart and capable. But it just goes to show you that the endocannabinoid system has its tentacles and its influence all across the central nervous system. And there's so much we need to learn about it. You know, that's just one case. I mean, there's so many, Alex, that are just life-changing for not only those patients, but families.
Could you imagine? He would have never have said, like, I love you, Mum or Dad. Oh, that'd be the first time they would have ever heard those words.
First time out of his mouth. Like how incredible would that be to hear that?
And how was that for you as the prescriber, like connecting with this boy and seeing through his eyes of the frustration and then seeing the change?
Oh, like we're buddies. Like he loves coming to the doctor's office because he knows that he's got that association between, you know, this dude, whoever he is, has allowed me, whatever he's given me has allowed me to, you know, do better and be less frustrated. And, you know, he's thriving at school and yeah, he's got his difficulties and he always will. And he's different. His brain's different, but, I think it's freed him up to really develop a lot better, a lot quicker. It's amazing. And that's motivating, buddy. Like that right there is incredibly motivating. And, gosh, that's exactly why I'm doing what I'm doing or because of those success stories.
How long ago was that treatment started?
Oh, probably 3 years ago.
And so it's continued. He's still able to talk and meeting milestones.
Totally.
Do you know what's changed? What unlocked that? With like, how did the medicinal cannabis work to unlock that?
Honestly, I'm not really sure, and nobody really knows yet. I mean, if we had a snapshot and could look with our microscopes and see the endocannabinoid system and see what opened up, but we just don't know it. So our brains are so complex. But the endocannabinoid system is attached to the dopaminergic system, the serotonergic system. It's there everywhere. You know, along the central nervous system and in our immune system, the influence is incredible. So yeah, there's so much to learn, and it's a really exciting, evolving field.
Yeah, it's just made me think of like Parkinson's disease and how, yeah, the change with dopamine, and then they eventually, you know, they can't talk and things like that as well. So yeah, what a fascinating area to be involved with.
I'm telling you, buddy, I'm so energized. My whole career has just went.
Do you have another one that you can tell us? Because that's an amazing story. I'd love to hear if you've got another great case study.
Yeah, look, I mean, there's another kid who had anger issues, like real anger issues, and he's part of his treatment. And I believe I probably met him at age 14, 15. Part of his treatment was antipsychotics, you know, because of his anger and his outbursts. And really that has a lot to do probably with anxiety and frustration, because he wants to do something, but he can't communicate. He knows what he can do and his limitations. Right. So, that has, you know, upon starting really a low dose CBD, almost no THC at all. Like within the first couple of weeks, you know, his mom shot me an email. She said, I can't believe it. Like after all the stuff that we've done, this one thing has allowed us to, you know, finally get a good night's sleep, not worry about him, you know, because he's with the antipsychotics. He had put on a lot of weight, and he's a big kid. And, you know, because of that, you know, throwing that body around, not many people can stop him. And, you know, that was going to be a problem as he continued to develop and get bigger through puberty and growing into be a man. So now he's graduated high school. He's still at home, but he's, learning to like a trade or not a trade, but like he's volunteering with a group, and, which is really, really amazing and fascinating to see that, that one tweak in his regimen was what allowed him to now potentially be on his own and take care of himself, without getting in the way of himself. So that's a great story, and being a part of that is, like I said, just so dynamic and motivating.
Can understand that anger, testosterone mixed in there as well, a teenage boy, and then, which they're all going to have those anger issues anyway. But then on top of that, having the restrictions and not being able to meet what you're capable of. Oh, I couldn't. Yeah, that would be incredibly frustrating. And you said with the antipsychotics, obviously one of the downsides for a lot of those are that they commonly cause weight gain, and they even blood sugar things, where people get diabetes and all those other issues that come with it. Do you see any of those sorts of side effects with medicinal cannabis?
No, not really. I mean, it can, and again, that's dependent on THC. We use THC a lot for that very reason, because with, say, for instance, cancer patients can be cachectic and body wasting and without much appetite, going through these horrendous therapies to try to get well. So THC can really improve appetite, improve their pain, but that's controllable. It's not like, and with the antipsychotics as well, but I haven't seen patients from being on medicinal cannabis from one year to the next gain 40 kilos. I mean, I haven't seen that. I'm sure that there are some cases out there, because it can increase appetite, but no, by and large, I'm not seeing that.
I think, and I can understand now more reasons why you're involved with this this industry or working with this particular medication, because by making certain tweaks with the ratios, you can either improve someone's appetite, or you can control it, or you can change a behavioral thing. There's so many amazing things you can do with this plant. It's a plant that was given to us. This was here on Earth for a reason, and it's not been utilized for so long.
It predates the written word, like, 10,000 years ago. I did a talk recently at the United in Compassion Symposium on the East Coast, and just preparing for that talk, I knew the history of cannabis, but to go back and see how many different, countries in China and Persia and Syria, the Hebrews used it, and for millennia, this has been used as a textile and a medicine and an entheogen, which is, involved in religious practice. And the fact that, early 1900s, we weren't allowed to use it because of really racism is a travesty, because we lost, at the time, in that early century, late 1800s, it was the most prescribed medicine, and companies like Bristol Myers Squibb and Eli Lilly, that was their number one medicine, was cannabis. And, then that was, deemed a Schedule 8. It was like the same category as heroin. And then there was 90 years for you. We weren't able to use it. We weren't able to research it. So I think, we got a lot of catching up to do, but I'm really excited because as we're reducing stigma and breaking stigma, and seeing these positive stories from one case to another, it's really allowing us to see the potential. And it's quite a dynamic plant, quite a dynamic medicine that has, lots of properties. It's not a simple thing. There's lots of minor cannabinoids, terpenes, flavonoids, and they all have a therapeutic property. So it's going to be a little bit more difficult to do research studies because of that. But I think, at one time in the future, I think we'll probably have indications and specific cultivar of cannabis, or minor cannabinoids that we're actually trying to prescribe for our patients because of that indication. We're going to be pretty specific with our cannabis plants and indications. So pretty exciting space to be in for sure.
Yeah, it's just the start. It's just the beginning. While we're on that point, I want to go a little bit political, but in the latest federal election, there was record votes for legalized cannabis party. What do you think this means? What does this say?
I think it's a wake up for everybody and all those old school folks that are stuck in that stigma. That there's got to be some changes. People are tired of the same old stuff, and that's what voting is. It's our representation, and it just goes to show you that people are more open every time we vote into using this plant and using it in a different way and opening it up. Not having it stigmatized anymore. There's still a lot of that there, but it's definitely on the up and up, and it's really exciting to see that representation increase every election.
I mean, it's like with anything or any kind of substance. If you use it right, in the right dose, in the right way, for the right person, it can be great. And like with sugar, if you eat too much, I mean, that would have to be one of the worst drugs. Sugar stuffs with the whole body.
Yeah, I mean, the fact that we're seeing research being done with psychedelics and MDMA and ketamine and these other much maligned therapies are now having some studies and having some real benefit, certainly in with psilocybin and PTSD. The studies are small, but when they go head to head and they beat our first line therapy of serotonin reuptake inhibitors, and we're not saying they're on psilocybin for the rest. They've switched it. They had 3 psycho assisted therapies, and they were cured. Like, they don't have PTSD anymore. They've changed their brain. PTSD changes the brain to where you're unable to inhibit fear, and that psychedelic journey guided by these practitioners, anywhere from 1 to 3 of these, it's cured people of their PTSD. That blows my mind. I mean, that right there is exciting. So yeah, you're right. We're now going to be able to use all of these, like, LSD. Well, look, it was synthesized and used in the 60s and 70s for that very reason. So here we are again.
These poor people are in situations that are just, they're at their wits' end. And, you don't want to, if you're going to be on something like an SSRI for the rest of your life potentially and still not actually reaching, optimal therapy or like feeling your best, they still don't work great for a lot of people. But then to go and do 3 treatments that are controlled under a medical scenario with someone overseeing, and then they're getting better, they're effectively being cured.
It's unbelievable. Like, it's hard to actually believe, but it's true. And people all over the world are now trying to duplicate those. I think it was 2 or 3 studies, small studies. I think the sample size was 60 patients, maybe. I'll have to look that up. I'm sorry. They're going to be duplicating that. And then we get these bigger studies. And, when those results come in and those are positive, where are we going to be at, Alex? Like, this is really exciting. It's going to be interesting to see how big pharma takes that, and are they going to be scooping up all of these smaller research facilities and companies and doing it? I certainly hope not. I'd love to see it in the people's hands. I'd love to see it decriminalized, first and foremost, because there's a lot of people that need those therapies right now, and stacking them away as a Schedule 9 and not making them available for us to use, like medicinal cannabis, in situations where we apply for it and it's managed and we have a plan and we abide by that plan and we notify the government. Why can't we do that? It's controlled. It's, what's the worst thing that can happen? Yes, there are contraindications and things we got to be careful with in medicinal cannabis and all those others that we're talking about. But gosh, if you can save people's lives, decrease the suicide rates, because PTSD and resistant anxiety these days, and that leads to suicidal ideation and intent, and doggone it, suicide. And our rates are way too high. We've got to do something. We've got to do something.
On that point, is suicide an issue with autism?
It can be. Yeah, absolutely. Yeah, it's one of those things that you have to be, it's one of those red flags that us as practitioners really have to be aware of. There's about 12. There's a list of things that we have to be really careful for. And definitely one of them is an increased suicide risk, just because of all those other comorbidities that make it so difficult for these people. And they're like, man, screw it, I'm out of here. And I get it. It's terrible. And we need to do a better job of diagnosing and supporting.
Some obviously have some fears around maybe starting a new treatment like medicinal cannabis. What are some of the fears that they might be having that would potentially be stopping them from even going and seeing you to have the conversation? And what is your process?
Yeah, no, it's not all about THC. Like when you hear cannabis, that doesn't equate to, getting stoned. There's many different parts of the cannabis plant, and mostly what we're using is the cannabidiol, majority cannabinoid, other than THC. Yes, we can use THC, but we use it at much lower limits. So that stigmatization, that, oh, cannabis, oh God, really? Should we talk to anybody about it? So yeah, those things we address expectations a lot. Like, look, we're going to trial this for, a certain amount of time. It may not work. This is how we're going to do it. We're going to be very mindful and methodical and start at very low doses and slowly escalate them until, symptoms are relieved and not have to escalate that any further. We go over their full history, what they're currently on, their liver function, all that, and making sure that there's not anything that we've missed that potentially could be, obviously these folks have an autistic diagnosis before they come to see me. So we're most of the time it's already a diagnosis. I still do GP 1 day a week. So I do have a part in diagnosis, but at mode where we're doing plant therapies along with, other things, but mostly plant therapies, that has to be addressed. So medications, obviously these kids have probably most of them have normal liver function, but something to think about because cannabis is metabolized that way. And making sure that the families and parents understand our follow-up process, that they can contact us anytime for guidance and support, and so that they can reinforce the plan if they have questions and wonder, okay, I'm to this point, where do I go from here? This has happened, doc. What do we do now? So, there's a lot of distressed people initially, and, after seeing them and starting treatment, a lot of them are much happier. So, yeah, I'm really happy to be a part of that.
Our last part as well, you're as a prescriber who works with people with autism, and as a parent, what would be your best advice to other parents who are going through this?
Well, look, I mean, I have some perspective on this one as well. And, I just tell my patients, look, I'm there with you. I know how it is. I know how difficult it can be during the process, and getting diagnoses and supporting and understanding your child. I get it. It's not easy. There's lots of tears and, sleepless nights and worry ourselves as a mom and dad, wondering, okay, how do we make this better? How can we, help our child reach their potential? So I do share that with my patients, that I do have some perspective there. I'm a father of an an autistic child, an ASD kiddo. And, I think that does ring a bell with most folks. They're like, oh, okay, he does actually get it. He's not just, throwing cannabis at us. So yeah, look, I think that's special for me because I'm an empath and I understand, and I try to help families through that process. So, and I know how difficult it can be personally.
And for you, was it just taking one step at a time, one a day at a time, and pulling in as much help as possible?
Yeah, shoot, I've got a an absolute star for a wife who reads a lot and who's all over it. And it's not just me. We're a team, and so yeah. Well, look, we gathered a lot of resources. We asked a lot of questions, and got the diagnosis really a little bit later than we always kind of knew, but we just started really reading as much as we possibly could, and and then talking to our providers and trying to understand what their management plans were, and deciding what was best for our family.
That's right. Every family's different. You got to work out what's right for you and your family, and go for it.
Absolutely. And having patience and no judgment, and providing all of these options for these families, and not trying to steer them in in the direction that you think they should go, because man, it is. Every patient's different. Every family's different. And, their journey is different.
So where can people find you?
Yeah, I'm in Dunsboro at Mode Healthcare. You can see me or contact us, make appointments on our website and on our socials. I'm on Instagram at Dr. Matty Moore. That's at DrMattyMoore. And I've got a website myself. It's Matt Moore, MD, MattMoore, MD is in medicaldoctor.com. My clinic email or website, is modehealthcare.com.au. And yeah, they can get lots of information, get some resources on our websites and on our socials. We do lots of videos. We like to educate. I do a lot of small videos and stuff with a really, really a special guy from South America.
My special man.
Yes, he's a special dude.
He is. Shout out, Kyle.
Shout out. What? So yeah, those are probably our website and our socials are really easy to find us, and you can book online at our website. So check us out.
I'll add all the links in the show notes so it's easy for everybody. And yes, jump over onto your Instagram because you have so many fabulous little videos on there that are easy for people to quickly digest and gather, as much information as they can. So go over to there. Thank you so much for being on the podcast again. I really want to have you on again in a few months' time, and we'll just keep going through condition by condition.
Awesome. Let's do it, buddy. Let's knock them down.
Fantastic. Thanks, Matty.
No worries, buddy. Always good.